Hi, I recognize that most doctors don't have you go home and watch a video for your after visit, but I really wanted to make it easy for you because I know you might have a lot of questions after you left our visit. In doing consultative menopause for many years now, I know that it is not easy to go through everything in one visit, including your health history, your goals and priorities, discuss all the different options, risks and benefits, and then pick something. So inevitably, you may have some questions left over. One of the reasons I started my podcast and my YouTube was to actually almost extend the office visit so you feel like you could be sitting and talking and listening from me, but I can actually work in my sleep. A lot of the videos that I really recommend you watch, I'm going to link here, including the one I have on the increased risk of breast cancer with the use of hormone therapy. That is a really great video that explains the risks of hormone therapy in breast tissue in great detail. A lot of you also ask about libido and libido options, and so I'm going to link that one here, and that one's great to talk to all about your options for low libido. Now, what I really wanted to do here in this video is actually just go over some of the frequently asked questions. The reason I wanted to do this was because so many of you do ask some of the same questions after you go home and you start on your medications. So if this is helpful to you, please let me know. This video you can only access if you have the link after you've seen me in the office. Inevitably, the questions I get the most comments on in the patient gateway are about bleeding or breast tenderness. Those are both signs that the estrogen level is probably too high if we're using hormone therapy and particularly estrogen replacement. Now, let's start with bleeding because that is usually the more common one. And this is really normal anytime you start hormone therapy within the first 6 months, even if it's been a really long time since menopause. And that's because the estrogen that you're taking is just stimulating the uterine lining, or more rarely, it could be causing you to actually have one more hurrah and you actually ovulate. We worry about it, particularly if it's repetitive or if it doesn't cease once we change the dosing. Whatever you are on, if you are having bleeding, I want you to stop and hold it. You can wait until the bleeding slows down, and then I want you to half your dose. So if it is a prescription patch, you can actually just cut it in half. You can do that with the estrogen-only patches and the estrogen and progesterone patches. You should be seeing me for follow-up, and if you had any bleeding and you had to cut your dose in half, you're gonna want to let me know. Also, if you're taking a gel like Divigel, then you can actually just do the same thing, wait till that bleeding stops, and then use half of the packet of Divigel. So that little packet, squeeze it in half, take half of it out, and keep the other half, use it the next day. If it's a pill, if there's a way for you to reduce the dose on your own, you can do that. So if you're taking estradiol, that's a tab that you can actually cut in half. But if you're taking a combination tab, something like Minvi or Activella, which are combined tabs, it's a little bit harder. So then please go ahead and message me and I'll help you reduce your dose in the meantime. If you're just having a little bit of bleeding or spotting or even what feels like a normal period, you don't need to let me know until you see me at follow-up unless there's something else that's really concerning, such as bleeding not stopping. Also, if you're having breast tenderness, I want you to go ahead and do the same thing. I want you to reduce the dose just as I taught you to do so if you're having bleeding. It's usually just a sign that the estrogen level is a little bit higher than is needed for you to feel well and alleviate your symptoms. Sometimes the breast tenderness is fleeting, so sometimes it can also go away over time. Other common questions that I get include, what about vitamins and supplements I can add to my regimen? I forgot to ask you about that while I was in my visit with you, and I have a great video here that I'm going to link to on vitamins and supplements that I recommend, and all of these are over the counter. Another question I get a lot from people is how to interpret your lab work. And oftentimes it's really to be taken in context. So, well, if I've had you get blood work on your first visit after seeing me, a lot of times, almost actually all the time, it's probably not going to change my plan until I see you at follow-up. And I do this pretty thoughtfully so that I can get you started and use your labs as more data. When you come back to see me, you tell me how you've been feeling and we take your labs together with that, and then we see how we might change your plan. Sometimes I see patients and we just get your labs and you see me 1 or 2 weeks later, in which case I'm going to be able to go over those labs with you. I have a good video here on how to interpret your lab work so that you can kind of do that without having to message me to interpret it for you. Although you know that I'm happy to, and I most likely enjoy doing that when I see you at follow-up. But if you kind of just really want to investigate what your labs mean, go ahead and watch that. And I'm also going to give you like a 60-second preview. If you're menopausal, your FSH is going to be really high, usually over 35, probably even higher than that, and your estrogen is going to be really low, between 0 and 20. And those are fairly normal levels of estrogen for someone who is postmenopausal. If you're in perimenopause, your labs can kind of be a little bit all over the place. So your FSH might be lower, somewhere between 20 and 35, and your estrogen level is just really wherever it happened to be that day. It could be low, say 20 or 30, or it could even be high, 50, 70, or 90. Those are all pretty normal. What about testosterone, you might ask? What does that mean? Now, oftentimes I do check your testosterone if I'm checking lab work, not always, but often because you're going to get your hormone levels checked, so I check it anyways. A low testosterone or a testosterone level that's low normal is pretty common. Just as women age, testosterone tends to decline. Now, do we need to treat your testosterone if you're otherwise having no other symptoms of low testosterone? We absolutely don't need to. What are the symptoms of low testosterone? Well, primarily it's going to be low libido, potentially also some issues with muscle mass or energy. If I'm going to be replacing testosterone replacement for you, I will typically walk you through that in the clinic, and we are going to watch your testosterone levels really closely. So what I'm all getting at is if your testosterone level is low, there's nothing necessarily that we need to do about that. I just wanted to capture that data while you were getting your blood drawn. A lot of you asked me about weight gain with hormone therapy. I have a great video here about weight, metabolism, and hormone therapy. I know we probably briefly talked about this in the office if it's a question that you have. Estrogen and hormone therapy typically is not associated with weight gain. We know that women who take hormone therapy have less weight gain compared to women who don't. And so if you feel as though your hormone therapy is causing your weight gain, I think that's something important that we should address. If it's a big question for you, simply start writing down your diet, start writing down your exercise regimen, and we can always discuss either decreasing your dose or stopping the hormone therapy if you feel like that could be contributing to weight gain. Another thing that it could be is actually a little bit of water weight from the progesterone component. So if you are taking progesterone, think about how often you take it, what dose you're on, and I might help you adjust that at your follow-up because it could actually be a little bit of water weight from the progesterone. If you have a question on refills, definitely go ahead and send me a refill request. I don't like you to be out of your medications. You don't have to send me a patient gateway for that. You simply could just send a refill request, or your pharmacy can do that. Now, typically, I'm going to want to see you if you're requesting something and I haven't seen you in over a year. So typically, I will see you at least once a year, or if not, that means that someone else could be prescribing this medication for you, which is absolutely fine. If you have just started seeing me and we're adjusting, I usually send you about 3 or 4 months worth of your prescription because I know we might be changing it shortly. And so if you need a refill, for example, if you ran out, just make sure that you have a follow-up with me at some point and I will absolutely refill it. I just want to make sure I'm going to be following you on your new medication, or if it's been a year, it's time for me to check in on you and see how you're doing. I have so much information here on YouTube that you're welcome to look through. I want to make it so that I can get back to you quickly, but also see as many patients who need my help as possible. So to help me do that, I've set up this video to see if I can help answer some of the questions that are routinely sent to me on Gateway that I bet could be answered here, and I will definitely be able to answer for you at your follow-up. However, if it's absolutely pressing and you're super confused and you need my help, Patient Gateway is always there for you, so feel free to send me a message. Please be patient with me. It's sometimes hard to get through. I get a lot of messages each day. And speaking of refills, and a medication that's particularly difficult for most women is for my women who are on testosterone compounded supplementation medications. What I would say to you is, if that is you, make sure that about a month before you're due for your refill, you send me a refill request. It's just so unfair that we have to do so much to make sure that women are, it's just so unfair that we have to go through so many barriers to get women their testosterone replacements. Every time that I get a refill request, I have to be at my computer, print it out on the computer that has the right printing paper, sign it and fax it over. So there's just so many little steps that I have to do. I'm happy and absolutely excited to do that for you. But on your end, just make sure if you're on it, let me know about 30 days before it's due for a refill that you asked me to get that to you so you don't have to be out of it. The main goal for everyone who is either on hormone therapy or even on the non-hormonal medications is to feel well and for these to improve your quality of life. So if for any reason you feel like they're not improving your quality of life, they're worsening things, or they're causing other side effects, that's what I am here for. And I will keep working with you every, 8 to 12 weeks so that we get this right. If in the meantime you are feeling kind of frustrated or you're really not liking the side effects from your medication, whether it's water weight or it's worsening headaches or migraines, feel free to either lower that dose or send me a message that you'd like to just hold on it where you are until you see me at follow-up. I'm really excited that I got to see you in clinic, and I love to use this type of way to chat with you so that I can do my best to be multiple places at once and really help so many women who are suffering in their midlife and menopause journey, just as you might have been. Okay, I look forward to seeing you guys at follow-up. Bye.